Hey friends, I'm so glad you found me. I'm Stephanie Carter Kelly, a physical therapist that uses yoga in just about everything that I do. Each week, I'm bringing you tips about how to relieve your chronic pain, and we're focusing on a series of videos now called Mind Your Spine. My goal is to empower you to take control of your own health, especially in this series, your back pain or your neck pain. So this week we're going to focus on mindful relief of back pain, and we're going to talk really specifically about how to relieve back pain with meditation. And stick around till the end because I'm going to lead you through a short meditation that I know will relieve some tension immediately. So first I'm going to give you some tips on how to relieve pain. There's research that shows that a mindfulness-based stress reduction program and other strategies of meditation can absolutely improve your function and decrease your pain. So how do you start a practice of meditation? First of all, you need to set a goal. Let's say that you set a goal for 10 minutes. You want to every day set a goal for 10 minutes to meditate. So the first thing I want you to do is to make sure that goal is achievable. When will you set aside time to do this? And make sure you allow yourself some flexibility of how you're doing it. Because early on, the temptation is going to be to quit. But I want you to find that motivation in setting that and keeping that goal every single day. And the first thing you might do is cut that goal in half because I want you to be successful. So a lot of times we set goals and they're very lofty. So if you say you're going to meditate for 10 or 20 minutes, cut it in half and do 5 to 10 minutes. Just cut it in half right now. And realize that in order to create a habit, there's some information that says you need 21 days to create a habit. You really need something like 3 times that much to create a habit. So if you can really give yourself 2 good months of every day, at the same time, every day, set it up that you are doing your meditation. The next thing is I want you to think about the position that is going to be comfortable for you. When we have pain, sitting is not necessarily the best position to do the meditation. So I'm going to give you some pictures of other positions that you can use, especially if you have back pain, positions that you can use to create some comfort in your back while you're meditating. You can use a reclined position. You can be on your back with your legs up. So look to the show notes and I'll get you pictures of how to create comfort. Third thing, look for resources that will help guide you through meditation. If you go onto my website, on the resources page of my website, I have some specific resources of guided meditation. One of them is using the Insight Timer app. I personally use it. I feel it's the best app out there because it's completely free. And there are some specific meditations on there for people that have chronic pain. So that's the Insight Timer app. There's also a website, University of California, San Diego has a whole page of guided meditations in the tradition of mindfulness-based stress reduction. And they start short. So if you're new at this, I suggest that you start with the short meditations, but work towards the longer ones because there is a dose-response relationship to meditation. The more you do it, the bigger the benefit. So give yourself the short meditations and work up as you are able to. I think we're on 4. Expect to fall asleep. So many people that have chronic pain are also sleep deprived. So in using the Insight Timer, or maybe you just want to set an alarm along with the Insight Timer because if you fall asleep, you want to be able to wake up from that. Or make sure you're allowing yourself some time when you can actually fall asleep. If you are finding that you're falling asleep on a regular basis, I suggest that you meditate twice a day. Once early in the day so that you can get some of the benefits of the full meditation. And the second time is before you actually want to go to sleep. Use the meditation so that you can relax into a deeper, more restorative sleep. It's okay. And the Insight Timer does have specific sleep meditations for you. I think that there's just so much sleep deprivation. And if you're sleep deprived, it is feeding into your pain sensation. So, if it takes you some time to get better sleep, and then you're going to get more benefit out of those meditations that you do early in the day. So the best way I have found to really start with meditation is to just pay attention to your breath. The flow of air in and out through the nose, the belly breathing. And there's no right or wrong way to meditate, but I'm going to lead you through that awareness of breath right now so that it gives you a focus. And I like to use, because I'm a physical therapist, I like to talk through the mechanics of breathing, because as I examine people, I do see that there's lots of structural or functional limitations in the breathing, whether we're not breathing into the chest, whether we're using the shoulders and just not relaxing, and maybe not using the belly to breathe. So I'm going to guide you through what I call a 3-part breathing, just to give you the mechanics and to give you a focus. So go ahead and find a comfortable position right now. If you're sitting in a chair, go ahead and support your back into the chair, relaxing your arms in the lap. Palms can be either up or they can be down. And I like to close my eyes or just gaze out over the end of your nose, gaze on something, fix your gaze. And then just bring your awareness to your breath. The flow of air in through the nose and all the way down to the belly. Allow your belly and the soft sides of your waist to expand as you breathe. In supporting your spine, you can allow the back muscles to relax. So as you inhale and you take that air all the way down to the belly, see if you can also feel some opening into the small of your back. Take several breaths, just focusing on air into the belly and into the waist, maybe into the small of the back. As you exhale, the belly falls. The air just escapes and flows right out. On the next inhalation, I want you to bring your awareness up a little bit. So inhale and fill into the belly, and then fill into a little bit higher, the high side of your waist. Let those ribs expand out to the side. Let your lower ribs expand forward and backwards. Inhale, fill the belly and into the lower ribs. As you exhale, let the ribs fall and then let the belly fall. Inhale, belly and ribs. Exhale, ribs and belly. It may help to place your hand into your side so that you can feel the rib cage expand out to the side, forward, and also notice if that rib cage expands backwards. Inhale, belly and ribs. Exhale, ribs and belly. With the exhale, notice if you can relax the shoulders down away from the ears. Relax the muscles that run down the spine. On the next inhalation, we're going to bring the awareness up a little bit higher. So inhale, feel the belly, feel the side ribs, and bring that awareness up into the higher ribs. Exhale, let the ribs fall around the chest, fall at the high waist, and then let the belly fall. Inhale, swell into the belly, and feel the lower ribs expand from the bottom all the way up to the chest. As you exhale, let the chest fall, and the ribs fall, and the belly fall. Inhale, belly, ribs, and chest. Exhale, chest, ribs, and belly. So if you can have this idea that as you inhale, you're filling a glass of water from the bottom all the way up to the top. As you exhale, it's like you're pouring that glass out. And so you're pouring from the top all the way down to the bottom. Inhale, belly, ribs, and chest, filling from the bottom to the top. Exhale, chest, ribs, and belly, emptying the air from the top all the way down to the belly. Notice the shoulders. Try to keep them relaxed. So as you fill up into the chest, the collarbones and the shoulder blades stay down and relaxed. You may feel some restriction up around that chest. So a lot of times that's the place where people don't take any air and the ribs don't open. Inhale, belly, ribs, and chest. Exhale, chest, ribs, and belly. Now I want you to bring your awareness where the neck meets the shoulder. We have the upper ribs. They're above the collarbone. So if you come to where the collarbone is, it's that space just above there in the curve of the neck. So inhale, belly, ribs, and chest. With your hand in this space, as you take that full inhale, can you notice those ribs elevate and lift? And then as you exhale, those ribs fall, the chest falls, the side ribs fall, the belly falls. Inhale, belly, ribs, and chest all the way up to the base of the neck. Exhale, base of the neck, collarbones, chest, ribs, belly. So it's different to have this space rise as compared to the tip of the shoulder rise. You want to feel like that rib cage is lifting up around the base of the neck, but the shoulder stays down. So this lifts up and this stays down. Inhale, belly, ribs, and chest all the way up to the base of the neck. Exhale, neck, chest, ribs, belly. And doing this just a few more times. Now, if you feel like you can't separate all 4 of these areas, it's okay. I think I said I was going to do 3-part breathing, but I added that 4th. Sometimes this takes practice. So if you feel like this pulls the shoulders up around your neck and gives you a little anxiety, just go back to any normal breath that you have, but keep coming back to this practice of belly, ribs, and chest all the way to the base of the neck. Exhale, neck, chest, ribs, belly. One more nice big breath. Inhale. As you exhale, let that tension drain out of the neck. And then go ahead and open your eyes. So come back to this video. Practice when you need to bring your awareness and your focus to your breath in order to create that mindfulness or actually to relieve your pain. This is a strategy to relieve your pain. So save this video, subscribe to the channel, tap the bell so that you come back each week to learn more strategies in order to relieve your chronic pain. I'm Stephanie Carter Kelly, yoga physical therapist. Namaste.